Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast. Today we're happy to have with us Dr. Kelley Allison, a radiologist with Sentara Healthcare's Tidewater Diagnostic Imaging. Thanks for joining us, Dr. Allison.
Well, thank you for having me today.
We're happy to have you. In a moment, we're going to chat about radiology and mammography, but first, I'd like to just introduce you to our audience. If you would, just please tell us about yourself, where you're from, family, educational background, personal interests, things of that sort.
I'm actually a native of Richmond, Virginia. Grew up and then went to undergraduate school at University of Virginia in Charlottesville. And after receiving my medical degree at Virginia Commonwealth University School of Medicine, I completed a residency in diagnostic radiology. And then afterwards, I completed a fellowship under Dr. Ellen Paredes in Richmond, Virginia at VCU in breast imaging. And since then, I have been a dedicated breast imager, providing 100% or dedicating 100% of my clinical time to breast imaging services of the community. I currently work in Newport News, Virginia, where I am one of the co-medical directors of a comprehensive breast center, and have been here for almost 14 years and very happy to be able to serve the women of the area.
So I must ask you, as you mentioned, you're a native of Richmond, attended both VCU for medical school, it sounds like, as well as UVA. Where do you fall? Are you a Ram? Are you a Cavalier or Wahoo? Which side do you choose?
Well, I'm always a Wahoo. It's hard to put that aside, but certainly VCU I hold it very dear to my heart. I definitely spent more time at VCU than I did at UVA, but certainly those undergraduate years stick in your mind probably the loudest.
Absolutely. I think a lot of people can relate to that sentiment. Let's talk about radiology. For those who might be unfamiliar, if you would just please explain what a radiologist does and the role that medical imaging plays in diagnosis and treatment.
Many physicians have referred to radiologists as a doctor's doctor. In other words, we are trained to be able to interpret images, x-rays, ultrasounds, different images of the body, to be able to help other doctors take care of their patients and answer those questions of what they're concerned with, whether it be from a cardiac issue to a pulmonary issue to diabetes. There are many different things that we can do as far as imaging to help answer some of those questions for the patients and help guide the physicians into the direct care.
When we speak to healthcare providers, it's always interesting to hear what inspired individual providers to pursue a healthcare career and to pursue a particular specialty. I wonder in your case, what drew you to radiology during your education and training?
Well, I grew up in a family of physicians, so medicine was always something that was near and dear to me, and I really understood from an early age what the importance that a doctor can have on patients and being able to make a real difference in people's lives. My father's a physician, my grandfather is a physician, all in the Richmond area. I've had aunts and uncles as well, and so it's something that's been very close to me. Deciding exactly what fields of medicine to go into was certainly very daunting because it's a pretty open, wide field of different possibilities. Radiology was something that excited me because I always like to be able to solve a problem. And with diagnostic imaging, certainly you can be able to examine x-rays, interpret films, and be able to answer the question that's posed to you by the referring physician and really make a diagnosis and an impact on that patient's direct care. As I completed my radiology residency, and I was really trying to decide from that point about which specific area of radiology I wanted to concentrate in, I had the wonderful opportunity to work with Dr. Ellen Paredes. She was a clinical faculty member at VCU and was very prominent in the field of mammography, not only in the state of Virginia, but nationally and even internationally. And I'm sure as many Richmonders know, she had passed away just a couple years ago and was really a big loss to the community. But Dr. Paredes really inspired me to get into the field and to make a difference in women's lives. Her passion and dedication to the women of the community, the way that she treated her staff and the way that her staff respected her, And I know many of her staff members actually followed her from Charlottesville, from when she worked there at UVA, all the way to VCU, just to make sure that they were staying and keeping true to her honor of upholding good medicine and being able to provide these great services for women. So that's something that really stuck with me, and she made a huge impact. And for that moment on, after working with her, even just for 1 month during my radiology residency, I knew right away that that was the field for me.
Sounds like a very inspiring figure, and it's always interesting to hear the people that we encounter along our journey that serve in mentorship roles. So I appreciate you sharing that with us. You've been a practicing physician, if I'm not mistaken, for the better part of 2 decades now. While I imagine each day in medicine is unique, can you share with us sort of a slice of your day-to-day activities, the kinds of patients you see and the work you do? Are your patients primarily or exclusively women, or do you see folks of both genders?
So my day, it's a long day. I think all doctors can relate to this, but my day starts at 7 a.m., so I'm up fairly early in the morning. I do have a family of my own, so I've got 3 children at home. Fortunately, they're teenagers now, and it's a little easier these days to get out the door than it used to be. My day starts early at 7. Typically, the day begins with a few procedures. There's usually a breast biopsy procedure to perform early in the morning, and it's nice to have those done when things at the breast center and times at the breast center are a little quieter, so we're able to get those procedures done quickly. A breast biopsy is a very simple outpatient procedure where the patient's here for about an hour, where we use just a local numbing medicine to numb the area to be able to take a small sample to find out if a woman has breast cancer or not. Certainly an important tool that we use at the breast centers. We do several biopsies a day. The bulk of my day, though, is interpreting screening mammograms. And hopefully your listeners who are tuning in now understand the importance of screening mammography, and that we do recommend that all women have a yearly mammogram. And studies have shown that having those yearly mammograms have really decreased the chances of women from dying from breast cancer by about 30%. So that's one of the main things that we do and services that we provide at the breast center is to interpret those screening mammograms, certainly looking for anything that could represent a very small early breast cancer. And if we do find things like that, we contact the patient immediately to return for extra imaging. And if needed, then we will also schedule them to do a biopsy. The vast majority of my patients obviously are women, and we probably on average have close to 100 women a day come through the breast centers. My partners and I are able to service the population, the community that we have here in Newport News. But we do have some men come through the center from time to time. Certainly men can get breast cancer, although not as common as women, but about out of every 100 breast cancers that are diagnosed, about one of those is diagnosed in a male patient. So we do always encourage men to be aware of their body and any changes that happen. So it's a fairly busy day. There's nice variety of what we do. I do spend a lot of time talking to patients, which I think is very important, to be able to reassure them that everything looks okay and that their mammogram was indeed normal and nothing to be concerned about. But unfortunately, we do have to give the diagnosis of breast cancer from time to time. And that's something that we take very seriously and certainly want to make sure that we do it in a compassionate way and also make sure that we can get that patient to the next person that she needs to see to go ahead and continue with her care and treatment.
You mentioned the recommendation that women receive annual exams, mammograms. At what age do you recommend a woman start that annual process?
You know, we do recommend that women start having yearly mammograms starting at the age of 40. There's been a little controversy in the media and with different medical associations about when women should actually begin having mammograms. There are some groups that recommend starting at age 45, some recommend starting at age 50, and many recommend starting at age 40. But the one thing that the entire medical community agrees with is that yearly mammograms starting at age 40 do save the most lives. So that is something that we encourage all women to take advantage of.
Over the years, there have been important advances in radiology, and I know you've been an outspoken advocate for the efficacy of imaging technology, including 3D mammography and the early detection of breast cancer, which statistics tell us, we were just speaking about women with breast cancer, that about 1 in 8 American women over their lifetime will experience a breast cancer diagnosis. What are your observations about the advances in imaging technology and how they benefit patients?
Just in my career of being a breast imager over the last about 15 years, I really came to see a huge change. When I first trained as a resident and as a fellow, we had film mammography. So patients came in, had a mammogram. There was actually film that they had to process and then hang on a view box for the radiologist to interpret. Similar to the way that an old camera would work, where you would go in a dark room to develop film and develop those pictures to look at. Since then, in the late about 2000, we did switch over to digital. So we went to digital mammography, where all the images became acquired on a computer system. And that was a big change for us. Certainly the images looked different. The quality was much better. And similar to how a high-definition picture would look on a TV screen or even a camera, that crisper quality of the image was a much better way for us to read films, and we were able to find even more cancers by looking at the tissue more accurately. And even more recently, we've switched over to 3D mammography, which is going to be the current and the standard of care for all breast imaging in the near future. 3D mammography is even a different way to look at the breast, where instead of looking at it with just a couple of pictures, we're able to look at it with multiple pictures in small slices through the breast tissue. And we're able to do that with a similar radiation dose as the prior mammograms that were performed. But studies have shown a huge benefit in the detection of invasive breast cancers, that we are able to find and detect early invasive breast cancer at a much higher rate using 3D mammography than the regular 2D or digital mammograms. It's also been a big benefit in the fact that we have not had to call back as many women for an abnormal mammogram. Many times a 3D mammogram will answer the question for us and we know right away that it's normal, rather than having to bring a patient back to perform a few extra pictures to confirm that everything looks okay. So a very exciting technology and something that the women of the community are definitely going to benefit from. And I do encourage all women, when they have their mammogram, to certainly ask for the 3D mammography.
Okay, well, that's good advice. Finally, you mentioned in your comments a few moments ago the compassionate approach that you, in particular, and other doctors generally take in dealing with patients, particularly patients who have anxiety about a diagnostic test and or a potential diagnosis that may come back from that. I wonder, in thinking back over your career, if there are any particular patient experiences that have stuck with you or that just for whatever reason remain memorable and important to you to this day.
One of the more challenging days that I had coming out into private practice after completing my training earlier on in my career, I had a very busy week. Our practice was looking to hire an additional mammographer to help with the workload because we had become very busy. And typically on Fridays were the days that we would have patients come back for their biopsy or test results. And I remember a particular Friday years ago where, unfortunately, I had all 4 women who came back positive for breast cancer. And I had them lined up in hour intervals for which I would need to sit down and talk to them and their family members about the diagnosis and about what we would need to do from this point to get them to the next step. And I found that I remember with that day not looking forward to certainly having this conversation multiple times, but really trying to make sure that I was truly there and available to answer questions for each one of those patients that came into the office. The first 3 patients that I saw, again, all with a diagnosis of early stage breast cancer, those first 3 had come in with family members. I remember one lady came in with her husband, another lady brought her daughter, and another woman had brought her sister in. And it's certainly much easier to talk to women, and I think easier for them to hear medical information, and even if it is unfortunately not so good news, as certainly a diagnosis of breast cancer is not, to have that family support in place for them to be able to listen comfortably to what information is being conveyed and have that family member be a real support and really a second set of ears for them to be able to answer questions later on that maybe they weren't able to hear after they heard that word of being diagnosed with early cancer. The first 3 women I talked to that day were going to do very well. They were diagnosed with very early stage breast cancer, and potentially all 3 of them would be able to be cured of their disease because it was caught so early. The last patient of the day that I saw, though, was a young woman, a young African-American woman who had just gotten off work and did not have anyone with her, did not have a big support system around her. And unfortunately, of all the news I had to give that day, hers was the one that was not going to have as good of an outcome. Her cancer had been detected later, and it had already spread, and it was a difficult conversation to have because I knew she was not going to have the same outcome as those other women whose cancers were caught early. And it really made me sad to think that if she had begun her screening mammography early, this could have been caught earlier and may not be such a potentially life-threatening situation for her. Those are the kind of days that certainly make you go home and appreciate your family and your loved ones when you see the types of situations that, other women have to deal with in the community.
Well, it's a powerful story, and I certainly appreciate you sharing that memory with us. And I'd also like to thank you for sparing a few moments of your time with us today. It's been an illuminating conversation, and I thank you for joining us.
Well, thank you for having me. Truly appreciate it.
During this portion of the podcast, we like to share an interesting healthcare story that we've seen on TV or read online or in a newspaper, and something that we think that we enjoyed, and we think if you have a few moments to search for it, you might enjoy it too. So Erin's going to share with us one of those stories. Erin?
Thanks, Julian. So this is a fun story. For their 20th anniversary, Scott gave his wife Cindy something far more precious than fine china or platinum, the gifts which you would commonly associate with a 20th anniversary. Scott gave his wife a kidney. The couple from Suffolk spent their anniversary at Sentara Norfolk General Hospital to undergo the kidney donation and transplant surgery. Cindy has a kidney disease she was diagnosed with in her 20s and had been on dialysis 2 years when her health started deteriorating. When Cindy's husband Scott was tested, the couple learned he was a match to be her kidney donor. The couple underwent a successful 4-hour surgery, and afterward, husband Scott said he could already see a difference in his wife. "Just the light she's got back in her eyes. I don't even have words for it," he said in an interview with WTKR News 3. As they heal, the couple hopes to raise awareness about living organ donors. To read the story, you can search online using the term 20th anniversary, kidney donation, and Sentara healthcare.
That's going to do it for today's episode of the Patients Come First podcast. You can find new episodes as they become available at www.vhha.com. You can also find episodes of the podcast on SoundCloud and on other popular podcast portals. We also encourage you to engage with us on social media, including Facebook and Twitter. If you'd like to send us comments, questions, or feedback for the podcast, you can do that through our Twitter account at VirginiaHHA, using the hashtag PatientsComeFirst. Thanks.